Hello, my name is Sakshi Kankar and today I am going to explain about the topic minimum criteria required for adverse drug reporting. The adverse drug reaction reporting plays a critical role in pharmacovigilance to ensure the patient safety and improve drug use. A report is considered valid if it meets the four minimum criteria. The first criteria is an identifiable reporter. First, we will see who can report. Healthcare professionals like doctors, pharmacists, or nurses. Also, patients or consumers. The person who experience the reaction or their caregiver or their relatives can report the ADRs. Then we will see why it is important to report ADR. The reporter provides the creditability and accountability for the report. The follow-up questions or additional information may be needed, so a way to contact the reporter. Example, name, phone number, or email address is necessary for identifiable reporter. Then the we will see what are the examples for a required information. The name or initials of the reporter, then the profession or designation of the uh, reporter, then the contact information of the reporter like email, phone number, or address. Their second thing is an identifiable patient is required for ADR reporting. First, we will see who is the patient. The person who is experienced an adverse drug reaction. And next we will see why it is important to identifiable patient, to ensure the report is related to specific individual and the differentiate one case from another. It allows the further analysis if additional patient details such as medical history or outcomes are needed. Then uh, um, then minimum patient identifiers are required. That are initials of patient, age of patient, gender of patient, and birth date of patient. The unique patient code for confidentiality in some systems is required. Then next thing required for ADR reporting is suspected drug or suspected pharmaceutical product. uh, First, we will see what is suspected drug. The medicinal product, vaccine or medical device through which ADR is occurred, are thought to be associated with the adverse event, are a suspected drug. Why it is important to identify suspected drug? To establish the potential link between the drug and and the reaction occurred. It helps in regulatory authorities and pharmaceutical companies to track which drugs may require further safety assessment. The examples of drug related details are like generic or brand name of the drug, the dosage form of the drug like tablet or injections, etc. Then the dose, route, and duration of administration, if known. And next we will see what is a suspected adverse event, that is adverse reaction. What is next we will see what is the adverse reaction. The description of the health issue experienced by the patient after taking the drug or using the pharmaceutical product is supposed to be adverse reaction. Why it is important to know the adverse reaction? This is the main component of the report that triggers the pharmacovigilance actions. Then it enables the characterization of the event. Example, the adverse event is mild, moderate, or severe. There are certain examples of reactions like symptoms, that is rash, headache, or nausea, or diagnosis made by a healthcare provider. Then the test results indicating a problem. Example are abdominal abnormal or liver functions test, or uh, any other test. Any life threatening events like hospitalization or outcomes like death or disability are considered. Then additional considerations. While these four criteria are the minimum requirements, additional information strengthens the ADR reports, medical history of the patient, and details of the drug the patient was taking, the to the rule out the drug interactions. Mm, then the time of the reaction, onset and duration. Then outcome of the reaction, if it is resolved, ongoing, or life threatening, etc. Then uh, uh, then uh, why we will see why these criteria are important for standardization. It ensures all the ADR reports contain essential information for evaluation. Then quality assessment. It helps in identifying whether the drug is likely to cause the adverse drug reaction. Then it helps in regulatory action. It allows the health authorities to monitor and investigate and mitigate risk associated with drugs by meeting the minimum criteria. And ADR report can serve as a valuable data point in improving the drug safety worldwide. Thank you.